Today, we're talking about pressure injuries, specifically how to understand each stage without getting lost in the jargon. By the end of this video, you'll be able to spot the difference between stage 1, 2, 3, and 4 injuries and know what to do next. Most people think pressure injuries only matter once there's an open sore, but the truth is that the earlier you recognize the warning signs, the more damage you can prevent. Let's walk through each stage and I'll show you what many clinicians miss. For those who don't know me, my name is Dr. Voltaire, a wound care physician, and in my first year, I misjudged a stage 1 injury and watched it turn into something much worse. Now I teach people how to avoid that mistake. If you're just getting into wound care, or if you've seen staging confusion in your facility, you're not alone. This guide is simple, visual, and designed for real-world care. Here's what we'll cover: what each stage really looks like in everyday language, why unstageable doesn't mean unimportant, and the one pressure injury stage that's often misclassified. Stick around to the end. I'll share the 3-question test I use to stage tough wounds with confidence. So what is a pressure injury? Let's start at the beginning. A pressure injury isn't just a sore, it's a signal. It happens when blood flow gets cut off from too much pressure, or pressure plus shear. The body gets starved of oxygen and the skin starts to break down, but it doesn't always start on the outside. Sometimes the damage begins deep beneath the surface, like a bruise that hasn't bloomed yet. That's why staging matters. Stage 1 is like your check engine light. There's no open skin, no wound, but something is off. The skin is red. It doesn't blanch when you press it. On darker skin, you might see purple or feel warmth or hardness instead. The area may feel tender, swollen, and different from surrounding skin. This stage is often ignored, but it's your first and best chance to intervene. So offload, reposition, and protect. Stage 1 is reversible. Have you seen this before? Where the skin looked okay, but something felt off? Now we've moved past warning. In stage 2, there's actual skin loss, but only the top layer. Think of it like peeling skin after a blister. You'll see a shallow pink-red wound bed, maybe some clear fluid, but you won't see fat, slough, or tunneling. Here's the catch. People often confuse stage 2 with skin tears, incontinence-associated dermatitis, or even fungal infections. Context is key, so look at location, pressure history, and what came before. Stage 3 pressure injuries are where things get deeper. Stage 3 pressure injuries extend into the subcutaneous tissue, so you might see yellow slough, rolled wound edges, and even some tunneling, but no muscle, tendon, or bone is visible. Imagine a scoop taken out of a soft mango. You're past the skin into the pulp. These wounds need real intervention, so debridement, moisture balance, and pressure redistribution. Have you ever seen a wound that looked clean, but deeper than expected? Let's break that down together. Stage 4 is full thickness skin and tissue loss, so you can see or probe to muscle, tendon, ligament, or bone. These wounds are often devastating, and they carry high risk of infection, sepsis, and even amputation. They may have slough or eschar, often tunneling, but the hallmark is the depth. These patients need full team support, so wound care, surgery, nutrition, and infection control. And remember, just because a wound looks clean doesn't mean the damage is done healing. Unstageable means you can't see the base. Maybe it's covered with black eschar, maybe thick yellow slough. Until it's debrided, you don't know what stage it really is. But don't be fooled into thinking it's less urgent. If you can't see the depth, assume it could be serious. I had a patient once with what looked like a dime-sized eschar, but once we debrided, it was stage 4. So don't underestimate what's hidden. Deep tissue pressure injuries, also known as DTPI, can confuse a lot of people. DTPIs look like dark purple or maroon areas under intact skin. They may feel squishy, warmer, or cooler than the skin around it. It's not a stage 1. It's deeper, and it may evolve quickly into an open wound. These are the tip of the iceberg. The damage is already there, we just can't see it yet. Here's my go-to staging check for tough wounds. Can I see the base clearly? If not, consider unstageable. What's the deepest structure I can see? Is there skin only? Fat? Muscle? Bone? Also, how did it get there? If it's over a bony prominence with a history of pressure or shear, it's likely a pressure injury. These questions have saved me from mislabeling many wounds. Remember that stage 1 injury I missed early in my career? It was over a sacrum. I thought it was just redness. We didn't act fast, and 2 weeks later, it broke open into a stage 3. That taught me that staging isn't about labels. It's about listening to the skin when it whispers, so it never has to scream. Thanks for watching. If you found this video helpful, check out my next one on post-surgical wound complications. You shouldn't miss, because recognizing early warning signs can change everything. Stay informed and heal well.